You're very, very welcome to this Belfast Healthy Cities seminar, in which we're going to look at the issues of returning to school amidst the challenge of COVID-19. At the outset, just to let you know how this session will run, because many of you probably got very used to doing Zoom meetings amongst your colleagues and amongst your teams, but a Zoom seminar may be something new to you, and certainly hosting one is something that's new to me. My name is Brendan Mulgrew, and I've worked with Belfast Healthy Cities for a number of years now, working in a communications and a public affairs role, and helping out with events such as this one. Normally we'd be in a room together and we'd be having a cup of tea and we'd be chatting to each other, but of course the very reason for the seminar is that we're living with COVID-19 and emerging into some sort of new normality around COVID-19, and today we're going to look at one of the most pressing issues, which is of course the return of our children to school. On a few housekeeping points, all of the participants will remain muted and with your camera off, so you should be able to see the panelists as the panelists are speaking, and the presentations will run on your screen. And after each presentation, a Q&A session will then open up with the speakers that we have lined up this morning, the three speakers. If you have any questions at all, please submit them using the questions and answers box at the bottom of your screen. And we will then collate those during the presentations and put them to the panelists afterwards. Very pleased if you use the Twitter hashtag for the conference, as you would do if we were in a room together, and that's quite simply hashtag Healthy Belfast. And I should say as well that all of the presentation slides, and in fact the recording of the whole seminar, will be made available on the Belfast Healthy Cities website after the event, and that's very easily found at belfasthealthycities.com. So before we move to our speakers, just to set the context for this morning's event, we want to explore the experience of, yes, in Northern Ireland, how we're setting about the return to school in a COVID-19 context, and by exploring the experience of other cities and indeed other organisations who have supported children as they return to education. And part of the role of Belfast Healthy Cities as a member of the WHO Healthy Cities Network is to facilitate a sharing of international experience with our own local knowledge. We want to look at how health literacy can support the health and the well-being of our society, of all of our society, including, of course, children. I want to just facilitate and to fire up some debate on what is the best practice on COVID-19 within the education setting, because it's an ever-changing picture, and it's great to have international speakers and international participants who've dialed into the conference as well, but anyone who lives here will have heard on the news this morning, of course, our education minister was explaining the latest guidance which has been issued, which was to do with children wearing face coverings in school corridors and in school communal areas, and having the option of using face masks in classrooms as well. And my own son set off to school today for the first time since I think the 13th of March. I was urging him to cycle to school as a new form of transport, and he said, but the bus is the best part. The bus is the best part of the day, having the crack with my mates. So that means, of course, wearing your face mask to and from school, and that's fine. Off he went, and off his pals went, and they're all wearing the face masks at the bus stop as they waited to get back to school today. But it is an ever-changing experience. There are different guidelines in parts of the UK. There are different guidelines emerging in the Republic of Ireland as well. So this seminar will share all of that sort of learning. And we know how important it is to get our kids back to school, and the role that school and education plays just in mental well-being, as well as the fact that we do want our kids not to miss out on the education that we've all been through, and they're all entitled to get as safely that they can get. So we're very fortunate today to be joined by speakers who have got experience where regions have gone back to school, and in other areas where there's been studies and examinations of the best means of getting children back to school. So our three speakers are Jenny Wiggle, who is the interim CEO of the Living Streets Project, and I'll introduce each just before they speak in full, and then Klaus Ordvedt Melcher, excuse me, Klaus Ordvedt Melcher, the special consultant children and young people in primary school setting for the local government of Copenhagen in Denmark. And then finally, Caroline Moose, who works for the World Health Organization Schools for Health in Europe network, also based in Denmark. So what we're going to do with each speaker, we have presentations from each one. So my colleague Anne is going to share her screen as we then move into each of the presentations. The first of which is from Jenny Wiggle, the interim CEO of the Living Streets, and the presentation is on the importance of the walk to school. And Jenny, just to give you a little bit of background, has worked in the charity sector for more than 15 years. She has led on the strategy and programme delivery and communications, and prior to joining the Living Streets project, Jenny was the head of schools and community youth, a global action plan, where we've heard this morning in our preliminary chat that work brought her to Belfast. That was some years ago, and hopefully you'll come back, Jenny, and see a much changed and, dare I say, much improved city as well. And as we said beforehand, under normal circumstances, you would have probably been on a red-eye early flight this morning to join us, but it's great to have you with us virtually as well. Jenny was awarded the Charity Times Supporting Executive of the Year Award in 2018 and won the Every Woman in Transport and Logistics Leader Award in 2019. So we're very, very fortunate to be joined by Jenny. So this presentation, I think, will take about 10 minutes. If there are questions strike you in the course of the presentation, put them into us via the Q&A button on the bottom of the screen, and we move into a conversation with Jenny afterwards. So if that's okay, Anne, can we move into Jenny's presentation, please?
Hi, I'm Jenny Wiggle, Interim CEO at Living Streets. In my presentation today, I'm going to share learnings and insights from our work with schools and their communities. Living Streets is the UK charity for everyday walking. In our 90-year history, we've had successes which include lobbying government to install zebra crossings, urban speed limits, and the driving test. We currently have a presence in England, Scotland, and Wales, but not yet in Northern Ireland. Today, we work with groups of people to encourage more everyday walking, and so with schools, workplaces, and community groups, and witness some great results. Alongside that, we campaign for more investment in walking and to remove barriers to walking, such as pavement parking. Our Walk to School campaign is now over 20 years old and began with our renowned Walk to School Week, which is normally held in May, but this year it's been postponed to October. In more recent years, we've established WOW, our year-round Walk to School challenge, which runs in primary schools across England, Scotland and Wales. We work in just over 2,000 primary schools with WOW to encourage more young children to walk to school. WOW is a badge reward scheme enjoyed by pupils, families and teachers alike, and we witness real change through the challenge. On average, our WOW schools see a 23% increase in children walking to school and a 30% drop in cars driving up to the school gate. We also run our Little Feet initiative in early years settings and Next Steps to secondary schools in secondary school settings. We recognise that there are unique challenges and also motivations for walking and travelling actively to school, and have adapted our programs which support each type of setting. A few stats on the school run. Data released recently by the UK government in their annual National Travel Survey shows that fewer children in England are walking to primary school. In 2019, there were 47 walked compared with 51% the year before, and 53% the year before that. In Northern Ireland, these figures are lower, with the travel survey in 2016 and 18 stating just 25% of primary school children walk to school. That was down from 30% in the 2013-15 survey. And in Northern Ireland, 61% of primary school children are driven to school, which is up 6% on the 2013-15 survey. Alongside this, we know children aren't achieving the right levels of physical activity, and amongst other health concerns, this is contributing to children leaving primary school overweight or obese, and this isn't all. 28% of our domestic carbon emissions come from transport, and with 1 in 4 cars in the morning peak on the school run, changing school transport has the potential to support emission reduction. The number of cars on the roads outside school is bad for our children's lung health too. 2.6 million children in the UK are in schools where fine particles in the air exceed the World Health Organization's recommendation limit. for air pollution. The current school run situation isn't helping our children to grow healthily. And it's worth noting that there are journeys which could or should be converted to being active. For example, in England, 20% of those who live within a mile of their primary school don't walk at the moment. These are the journeys we're particularly keen to explore and encourage to be walked, cycled or scooted. Social distancing requirements in response to COVID-19 increases the need for action and highlights the need for other changes too. For example, living with poor air quality can further complicate COVID-19 symptoms. And the need for social distancing has placed big constraints on public transport capacity. And it's vital that parents don't respond by jumping into their cars for school transport. The UK government, as an example, has responded positively, providing additional funding in England to support coach and bus travel to school, in addition to the funding made available for walking and cycling. And the 40 million investment in school transport announced by the Education Secretary and the Transport Secretary recently has been welcomed and will positively support the education restart. And this sits alongside the $2 billion investment already made by the Department for Transport in walking and cycling earlier in the year. This example presents a real opportunity to use the current positivity around walking and cycling to change the school run to a school walk, scoot or cycle. And there are examples globally of government investment in active travel. But we also need to think about how we create additional space around schools to ensure that the school walk is safe from a COVID-secure perspective, and also to reduce the number of vehicles around our schools to improve wider road safety and air quality. I want to focus on inequalities for a moment. Tackling inequalities should be front of mind when we're planning improvements to our streets. COVID-19 has exacerbated differences. While we all experienced lockdown, we did not all experience it equally. Department for Transport's COVID-19 travel tracker showed us how much more people walked or cycled during lockdown. But there continue to be big inequalities in physical activity levels. And a Sport England Active Live survey showed us that older adults remain less active than younger adults. People from lower socioeconomic groups remained less likely to be active than people from higher socioeconomic groups. People with a disability or long-term health conditions remained less likely to be active than people without a disability. And people from mixed and white backgrounds were more likely to be active than Black and Asian adults. So what does all this mean for walking environments? Well, it really highlights the need for us in the current short-term improvements to the walking environment to make sure these are spread across all of our communities, not just high streets and leafy suburbs, and for some serious thought to be put on how to embed these improvements for the long term. And it reminds us of the need not to forget to deal with our main roads. There's a demand right now for ensuring that the changes we make benefit both walking and cycling. And for us at Living Streets, that points very clearly to two things. Low traffic neighbourhoods, where we use modal filters to create neighbourhoods that are low traffic or traffic free, providing safer and more pleasant spaces for walking and cycling. And ensuring the safety of the walk to school as our children return in September, combining school streets with other interventions such as low traffic neighbourhoods, but also better crossings and 20-mile-per-hour zones. Walking is free, easy and accessible. We can use our streets to travel short distances, whether we're on foot, in a wheelchair or using a mobility aid. That being said, we need good walking infrastructure and motivation to change our behaviours and opt for walking as the main mode of school travel. Through our WOW Challenge, our Walk to School outreach programs, we are witnessing change across the UK. How good would it be if every school could have access to our WOW Challenge, which has a real impact? These programs would add much benefit to any school, but in conjunction with school streets, low traffic neighbourhoods and slower speed limits, they can have a really profound and long-lasting effect. Cycling and walking schemes deliver fantastic value for money, typically producing returns of £4 to £19 for every pound spent, compared to road building, which typically returns £3 to £5 for every pound spent. Such investment leads directly to cleaner, healthier and safer communities. Well, why are these rates of return so high? Because walking and cycling have such high health benefits, have zero emissions, and reduce vehicle numbers on our roads. This slide shows the outcomes of our Walk to School outreach project with DFT, returning a BCR of 10 and 38% increase in walking for new schools joining the scheme, a reduction in vehicle miles of around 500,000, and with 1.3 fewer car journeys and 1.3 million fewer car journeys and 4 million new walking trips. Investment in street infrastructure schemes like school streets and low traffic neighbourhoods will help to create an attractive and safe walking environment. Investment in active travel behaviour schemes such as WOW will help embed a change in travel choice. Together, they can change the school run into a school walk. Thank you.
Thank you, Jenny. Jenny, for some perhaps technical reason, part of the presentation was a bit blurred on screen. Could you, if you don't mind, there was a slide there 2 slides ago, which was a Walk to School outreach case study. I don't know if you can call it up on your own screen there, or perhaps you know it, perhaps the figures are in your head. Could you just talk us through some of the stats which were on our screen, but perhaps not very clear, because that seemed very interesting to me and appropriate.
If you bear with me, I'll see if I can bring that one up.
It looked like a case study, I think.
Yeah, so it is a case study. It's our Walk to School outreach program, which we've delivered with the Department for Transport here for a number of years, and it's based on our approach with schools, which is having an embedded officer working with local authorities and then reaching out to schools. So they do the WOW program, which is our badge program, but they also look at some of the other barriers that there are to people walking to school, do school route audits, run assemblies with them. So let me just bear with me, and I will see if I can actually, hopefully that brings up so the can actually, if you would like me to share it, I can attempt to share it. Let me just find the...
Okay, thanks, Jenny.
So here is the...
Yeah.
So that's the current slide there.
There we are.
So I was talking through those particular different parts of it. Now that program has run for a few years in different parts of England, and what we do with that program is we focus in on the large transport authorities. So Manchester, Greater Manchester, where we've got a combined transport authority. Liverpool City region is involved in the program. West Midlands, and we're working particularly there. So there's in more built-up areas where we've got the opportunity to really change those journeys where people would be driving and changing them to a walking journey. But those are the project there. So sustained walking increase of 38% when schools start to participate, and then they sustain that increase as they carry on with the program. So it's really important that programs are maintained and there's opportunities for schools to continue to participate, because every year you get a new group of pupils.
Okay, great. Jenny, one of the attendees has asked a question and asked if you could comment on the social and the mental health and well-being benefits for walking to school.
Oh, yeah. Yes, absolutely. Huge benefits. I mean, huge benefits for the families and the carers and the parents as much as the children as well. I think we've got to remember that for walking has proven, we were really starting to focus on that before COVID even hit. And then once COVID hit, it really showed everyone how important walking is. But the mental health benefits of actually just going out and walking have been well documented. And then for families, I've had families say to me, and parents say, we have one parent who would say to us, I walk the 15-minute walk, which is all it was each day, to my local school. I learn more about my child in that 10-minute walk than I do at any other time of the day, because it's the one time when it's me and my child, we're not distracted, I'm not trying to do something else, they're not trying to do something else. And he just said he wrote to us and said how upset he was this child was going to secondary school because it was about to stop, and he'd had this really precious time. And I just think that in itself, in terms of a mental health benefit for families, you just can't replace that. And there's no way that sitting in traffic in a car is anything like that for parents. But there's the fresh air, there's the socialising, there's the independent skills that children need to learn as well. Too often they're going to secondary school without having developed these independent skills of just how they get themselves around. You were talking about your child going to school, how important that socialising is, and that mental well-being of being with their friends, and actually the travel to school and the walk to school really gives them that opportunity.
And I think we can probably all agree on the mental well-being and the mental health well-being advantages of walking to school. Go back to the physical element of it, Jenny. Is it something that you've looked at? Is there an optimal distance that a child should be walking? I mean, how far can a primary school child walk? Is it a kilometre? Is it a mile? Is there a standard that you should, in general, apply to that?
I think I might defer to someone who's a physical child development expert on any limits on that. But I certainly think, we certainly talk to families about the mile to school, and and for everyone we talk about the 2 miles, which families or adults could be easily converting to a walking journey. And when you've got the time as well, you take the time factor in, it's not that much further or that much longer. But we certainly talk about those journeys under a mile that children could be walking to school. And there's huge physical benefits, and it's not just right now, it's setting up that habit for life and setting up those physical just moving. We don't move enough, our children don't move enough, and we definitely don't move enough. We talk about obesity crisis in the UK, but actually we've just got a physical activity crisis, a physical inactivity crisis. We are physically inactive, grossly physically inactive, and it's setting ourselves up for all sorts of problems. And if we talk about COVID, people have, it is shown that the some health challenges that people have through being physically inactive have not helped them in terms of being able to cope and recover. So walking is already playing a part in people's recovery. There's conversations we're having with people involved in Public Health England about the recovery from COVID for people who have suffered, and that walking's that first step as well to becoming physically active. If you haven't been physically active, what do? You get off, you get out of your seat and you walk to your front door, or you walk to your shops. A few people might jump on a bike or head to the gym, but mostly they walk. And so for our children, that's got to be the part of their everyday activity.
Okay. And of course, your work, Jenny, exists for a good reason pre-COVID. And if it wasn't for COVID, you would still be very busy and you'd be rolling out such pilot studies, etc. But is there one particular COVID-related issue that makes your work that more relevant or more pressing? Or is that maybe that's an unfair question to put you on the spot?
Yeah, no, COVID has been quite quite incredible thing in that people suddenly understand us. That's been actually a really interesting thing. We don't have to explain ourselves. People like walking. That precious moment where I was allowed out of my house, and one thing I could do each day was go for a walk, and wow, that was really helpful. I could go out with my family, we could do those things. But the thing that it's really shown straight away, and we've been calling for 90 years, because that's how long we've been around, is that there's not enough space in our towns and cities. There's not enough space in the way that we design our towns and cities for people to get around on foot. We have the pavements are too narrow. And when COVID hit and suddenly everyone was trying to get out of their houses, people didn't have enough space to socially distance from each other. And that was causing all sorts of anxieties and showing the problems that we have on our streets. And what was interesting was, because the cars weren't there, suddenly we were walking down the centre of our streets and people started to reclaim them and go, actually, this is how I want my neighbourhood. This is nice. This is really important. And then everyone's noticing those narrow pavement ways, because the roads and cars just keep taking that up and taking that up. And when it comes to something like cycling, one of the things that we work really closely with cycling organisations, because it's really important active travel's done together, but it's really important from the outset that we don't put a cycle lane in by taking away a footpath. We need to be replacing parts of our road where our cars are with our bikes, and we need to be making space for both of those forms of transport.
Okay, thank you. There are some comments coming in from some of our delegates. I think that's probably the right word. And Chris Little, you're very welcome. Chris, of course, chairs the Education Committee at Stormont. And Chris and both Harding are pointing out that, of course, something you mentioned there just now, Jenny, has been the importance of cycling to school as well. And we do have, it's important to acknowledge that we do have programmes in place locally through sustrans and through DFI and Public Health Agency do fund programmes locally which promote, try to increase the number of children who are walking, cycling, or using their scooters to get to school. So we're not starting from zero here. We have been down this road. Perhaps more could be done by either the department or by the Minister of Education to promote walking and cycling to school. And maybe COVID, and maybe coming out of COVID, gives us the opportunity and the context to promote on an even more sustained basis, promote walking and cycling to school. And that's something which we're going to literally see on our streets in the weeks ahead. And so it's something as well that Belfast Healthy Cities is very aware of and have carried out studies. Joan, you might want to talk about the studies we've done around walkability, where we have been out literally onto the streets of Belfast to examine what it is that prevents people from walking, not just school children going to school, but older people going to the local park, parents going to do their shopping. And we just discovered some very basic impediments, such as cars taking up half of the pavement when they park irresponsibly and carelessly, litter on the streets, which is off-putting to people as they go about walking either for exercise or for going about their daily business. And there's more that can be done to just make the streets more walkable across the board, not just for school children.
Yeah, absolutely. With our school programs, we do school route audits as part of the Walk School Outreach project, which I shared the slide on, and that is looking at exactly that. How are children? What are the routes for families to walk into school, and what are the challenges and the barriers along those routes? Where are the crossing points? It's no good putting a crossing point way somewhere else. We all know about desire lines if we're in transport, in particular if we're walking. Someone puts a path over here. That's the path I want to go, and it's the most direct. That's what I'll do. Mm-hmm. And it may not be where you've put a crossing point, but that's where I want to go as a person.
Well, actually,
they may not be safe. There may not be safe crossing points. So children will cross most directly. They'll do what that human thing is, and they'll go directly to those points. You made an interesting point about the litter as well. That is something, litter, and I must say, in our route audits, in our community route street audits, dog poo comes up all the time. Litter and dog poo. And these are about places being attractive, somewhere where you want to go out. You want to go out into your street and you want to walk. And if it doesn't feel safe and it doesn't feel attractive, then people will retreat to something else that makes them feel safe, which will be their car or staying in their house or what have you. So it's really important that we have that these routes are attractive, that there's things to see, that they feel safe, that they're safe crossing points. Now, it's the same with the things that are being put in place for bike routes and making those safe and making those segregated. Our pavements need to feel safe. They need to be free from obstruction. Pavement parking is a huge problem.
Absolutely.
A-boards in the middle of a street are a huge problem for older people. Pavements that are poorly maintained, the fear of falling is one of the huge things that comes out from our older people's programs. Trips and hazards, fears of falling. Going into the winter, you mentioned that before as well. Icy pavements.
Yeah.
We do something about our roads, and we don't do anything about the pavements that people are walking along. And we have children and families, you will have had it yourselves, where they end up walking down the road to get to school because that's where it started to be cleared and they're worried they're going to actually slip over in the pavement. I mean, where's our priorities there that that's what's happening? Yeah. So these are things that are quite obvious, but they're incredibly important. We're going to encourage people to want to walk down the streets.
Yeah, we'll probably finish with this question, actually, before we move on to our next presentation, Jenny. Just as you were chatting about routes to school, Roy White, who's one of our attendees, has posed the question, very simple, very direct question: should schools provide maps which indicate the safe walking and cycling routes to their school? Isn't that a very practical suggestion for day one, P1, here's the
Yeah.
safest walking route or cycling route to school.
Yeah, I think that's a great idea. It really helps with the transition. But what I suggest is actually the pupils from the school that they're coming to provide them for the pupils who are going to be attending that school. So instead of, we can work with them to do those, but we find them really successful because then the pupils have the ownership of it. They go out, they know what those safe routes are. These are the best routes to come in. These are where everyone will be coming along and through. And then you can focus on making sure those routes are your focal point for being safe. But definitely the pupils, they'll enhance them, things that you can see and do along the way. So that's a definite recommendation there.
Okay, very good. Thank you very much, Jenny. That was that really set that really in a very, very helpful way set the context for the conversation that we're going to open up. So thanks a million, and I know you're able to stay for some part of the discussion to follow. So
looking forward to it.
That's great. And now, folks, we're taking you all the way from your living room or your office to Copenhagen, and we're going to have our next speaker is Klaus Artfed Melcher, and I hope, Klaus, that I'm doing justice to your name in that pronunciation. And Klaus is part of the local government network in Denmark, and he is a consultant in the Office of the Children, Youth and Public Schools and local governments in Denmark. So it's not just, while he's based in Copenhagen, he of course has experience across all of Denmark. His areas of expertise are digital support for learning, for well-being, and the transition from daycare to preschool in schools, and the inclusion of children who are in challenged positions, and also parental involvement. Prior to working in local governments in the spring of 2019, Klaus was a deputy school principal, so it's very practical experience to bring to this conversation. And since the start of the whole pandemic, Klaus has been involved in the government's response and communicating the necessary measures of local government throughout Copenhagen, throughout Denmark. So we're going to move to your presentation now, Klaus, and then I would just say again, those who are attending the conference online, any questions which occur to you in the course of the presentation, use the Q&A box and we'll put them to Klaus and to any other panelists that have a point of view for after the presentation as well. Thank you.
Right. Thank you very much for allowing me to put the perspective from Denmark to good use for you. First, we have to set the scene that the public sector in Denmark is highly decentralized. There is the basic principle of subsidiarity. Whatever can be dealt with on a local basis is going to be dealt with on a local, which means that delivering daycare happens on very different ways in the 98 different local governments in Denmark, and that also means that what I'm going to say is something more in general about what has been the official guidelines and the official communication about reopening schools, but there has been a huge variety in how to make local responses to the different challenges. And of course, the main challenge was when it comes to reopening schools was dealt with in April. And could you change to the timeline, please? Right. Of course, on the 16th of March, all schools and daycare facilities closed, pretty much from one day to another. And then on the 15th of April, we started a gradual reopening for children from the first to the sixth school year. And it became clear from the local authorities and the health authorities of Denmark that you could not do this just from one day to the other. So the government decided that from this day and forward, it was allowed to do the gradual reopening, but you were not allowed to do it before the local government and the local authorities could say that this is done in a safe way according to health authorities' regulations. And the gradual reopening was done with some basic rules. You had to be more than 2 meters apart for the great deal of the day. You were to have a strict hygiene regimen with washing their hands and cleaning the surfaces more than one time a day. Before, after having been outside, going back inside, changing facilities was there was a rule that you had to apply to hand washing your hands, and the main focus on this point was not the full curriculum of the schools. It was part of the curriculum, whatever it could be handled in a good and safe way. But other than that, it was mainly there was a lot of focus on social interaction, the mental health of the children, how to become part of a group again. That was the main issue, and then of course teaching the children the safety precautions that were needed. And then on the 18th of May, there were the regulations were changed so that now we could have more children inside the daycare centres and the schools, and so we were able to open up for the children in the rest of the school years, still on a limited basis. The normal rules of regulations of schools and daycare centres were still not put in place. It was still the health authorities' regulations that were the main priority, which meant that it was a limited curriculum. It was a limited amount of teachers that these people, the students met. There was a limited opportunity to do different subjects, and again a lot of focus on hygiene and on how to have social interaction in a safe way. That changed in the 1st of August, where the sort of, you could say, the priority between the normal rules and regulations for schools and daycare centres were then given the top priority, and then the health authority regulations were to be applied to if it was possible. So now schools could not limit the amount of curriculum. You have to have the full curriculum, and you were to change the teachers when it was called for, in order to have an educated teacher in the students and the children. And right now we are seeing a lot of local response to sort of fluctuating cases of COVID-19. That you have local governments, municipalities, and areas in Denmark where the number of people who are affected by COVID-19 is rising, and then schools are to provide facilities that take care of that. And for example, this Saturday, it's become mandatory to wear face masks in public transport for all above the age of 11, and that has been a challenge to schools, because in Denmark it's written in the constitution that going to schools is free. So the schools have to provide the face masks for the children that are forced into public transport in order for them to be able to go to school. Right, I think that was the main lines in what has been the Danish response, and I think I think it's well spent some time for Q&A.
Thank you very much, Klaus. That was very informative, and it's interesting that the rules and regulations bring your constitution into play. I must say that's not something that we have embraced, and I think the less we leave the constitution out of those issues in Northern Ireland, the better. Klaus, and before we move on to other questions from the other members of the audience, delighted that we've now, using our fantastic technological expertise, we've given Chris Little the status of a panelist. Chris is an Alliance Party MLA who chairs the Assembly Committee, which is the committee at Stormont, which shadows the work of the Department of Education. And it's fair to say that even if you set COVID to one side, the challenges facing the Department of Education and therefore the Committee for Education over this last probably 2 weeks or 3 weeks have just been absolutely enormous. Everyone here is fully aware of the controversy around how grades were handed out to GCSE students, A-level students and AS students. And to be fair, Chris very clearly led the political response to all of that, and his committee was to the fore of this last few weeks. So Chris, in that context, we're delighted to be able to join today's event. And maybe it's a bit unfair to put you on the spot, but on the back of what you've heard, both from Jenny and from Klaus, maybe you can give us all just a little bit of context around the situation as applies locally in the return to school.
Yeah, thanks very much indeed, Brendan, and a pleasure to join the session today. I'm very grateful to have heard from previous panelists already with some insightful contribution. I think the key thing in Northern Ireland, as I imagine across jurisdictions, is that teachers want to get pupils back to school. They fully appreciate the importance of getting children and young people back into the school setting for a wide range of reasons. And they are dedicated, resilient professionals, so they will find ways to do that safely. But I think the feedback that we're getting as an education committee is that the departmental ministerial guidance has been somewhat unclear in terms of certain items. Face coverings has been mentioned. The approach to be taken for pupils who have been clinically vulnerable or pupils with family members that have been clinically vulnerable during COVID-19, practices around testing and isolating, and when and how remote learning would be delivered in those types of circumstances. A lot of responsibility, in my opinion, has been placed on schools, for example, around risk assessments and making decisions on issues that are quite medical in nature. So I think we do need to see a joined up approach between our GPs, our consultants and our teachers, which is what the Minister is asking of them. But again, I'm not sure how much guidance they've been given in terms of what that will actually look like on the ground. The other key issue, Brendan, is resources. £40 million has been earmarked for school restart. I don't think any of that has been allocated yet. And yet, as you'll be aware, perhaps important for me to say, as you've said earlier, Brendan, that pupils are now back in schools here in Northern Ireland, like yourself. My son started this week, my daughter started next week. So schools are saying they need additional resources for a lot of the things that Klaus referred to in terms of enhanced cleaning, enhanced sanitization, substitute and additional teaching and non-teaching staff cover, school adaptations in Northern Ireland. I imagine a lot of our school infrastructure is slightly older than other jurisdictions like Denmark, I would imagine, and perhaps also what the curriculum is going to look like and how it will be assessed. Our curriculum and examinations body, SEA, has only just published a public consultation on what our curriculum and our examinations will look like next year, having got through the difficulties, as you say, in terms of last year's. That closes on September the 7th, and it's a key priority being raised by teachers that as school has restarted, they need to know what that adopted curriculum, that adopted assessment approach is going to look like. So those are some of the issues we're grappling with in Northern Ireland, Brendan, and it'd be good to hear from Klaus maybe around how they improve teacher-pupil ratios, what sort of social distancing and face covering practices are being used in Denmark, and maybe also the guidance around testing and tracing. Department of Education and Public Health Agency have been said to be working on a bespoke school COVID-19 testing regime. It'd be good to hear whether other jurisdictions have used approaches in that regard. But teachers want to get pupils back to school. They need the guidance and the resources they need to do that safely.
Okay, thanks very much, Chris. Klaus, can you come back in on some of the very practical questions that were posed there around your experience? And just for clarity, Klaus, you did say that your school system is going back to the full curriculum as it was pre-COVID as well. Yes. Okay.
Yes. By the 1st of August, that was reinstated. In the gradual reopening, there was a lot of emphasis on the distance, social distancing, and that meant that what you mentioned, Chris, about a higher ratio of children to teachers, simply because there couldn't be that many children inside the same room, and that meant smaller groups. And one of the things that we're very interested in local governments right now is what experiences do we bring forward now that we're on a normal curriculum, on a normal teacher to children ratio. What is it that we can learn from the fact that we had the opportunity to work with smaller groups? Of course, there's also always the question of resources in this, but there are some low-hanging fruits that you could work with in local resource management. The other thing that you mentioned, Chris, about exams and testing, that was postponed in the spring, and we are right now in dialogue and at times discussions with the government and the ministry about how do we have a decent image of the progression of our children, and there's a particular political interest in what has been lost during the remote education during springtime. Is there something is there a particular skill or a particular subject that has suffered from the closing down and gradual reopening of schools?
Thanks, Claire. We have a couple of very practical questions which have come into from attendees. Claire, you may be in a position to answer these off the top of your head. Kate has asked, are there any health improvement programs run in schools, such as toothbrushing? I mean, pre-COVID, would these things have been in place, and are they still possible in the current situation?
Right. As I mentioned right at the beginning, this is a very decentralized school system. Yes. So we don't have a national program on health improvements besides from physical activities and rules about 45 minutes a day of active physical activity. So something like that, where you have a lot of concern about COVID-19 is not something that is on a national scale. There has been a lot of focus on how to do our normal curriculum in physical activities, but also in a subject as, for example, as music, where in singing or shouting, yes, yes, there is a high risk of exposure. So in that sense, there are some things that you cannot do because it makes no sense right now. But it's not something that is based in a national program.
Okay, and a very linking back, Klaus, to what you've outlined, to what Jenny talked about earlier on, in the way families travel to school. Has there been any discernible, noticeable change in the way families do travel to school post-COVID? Is there more walking, cycling going on, or would you say it's as it was?
I haven't got any numbers to back up any sort of feeling that might be, but there has been a concern that the fact that now face masks are mandatory, that would limit some children's access or access to schools, or pushing them into the family car, because then you can travel without using face masks. But as I said, the mandatory face mask was on Saturday,
Yes.
and I haven't got any numbers to back up any kind of development in that.
And is there any have any schools where there has been testing, have any schools had positive tests for pupils? Has that led to any closure of schools or temporary closure of schools?
We're seeing now with the enhanced emphasis on testing, we're seeing now that there has been sort of local outbreaks. There hasn't been any closure of schools as far as I'm aware, but classes or school years have been sent back, sent home, and then taught from a distance, and they can return when they COVID, or within 48 hours of not showing any symptoms. But right now, that's actually something that's debated on, because we don't want too many children to be sent back for no reason, because that puts a lot of strain on them, but it also puts a lot of strain on their parents, and what their possibilities to stay at work. So there's a lot of emphasis on that right now.
And Klaus, what about the a couple of questions raising this point? One from Jacqueline Crow. What about the non-classroom activities? I mean, are there breakfast clubs? Are there post-school nurseries? Child-minding clubs or homework clubs? Are they running as they would have been?
That's probably where the guidelines from the social authorities still have the most impact, because it's been very clear that you have to keep the children in pretty much the same groups. Mm-hmm. and the after school and before school activities are not normally arranged that way. Usually that's larger groups of children that chooses activities for themselves, and so that this is a very different way of providing these kinds of facilities. And we also have a huge concern with that, because that has resulted in a lot of children being not being a part of those activities anymore. That just go home after school, where they usually were in some kind of after school activities. And we're a bit concerned, are very concerned about the health and the social health of these children. What kind of setting are they returning to from after school?
Okay, Klaus, thank you very much. Are there any other panelists want to put something to Klaus before we move on to Caroline? Okay, Klaus, has been really useful to hear from a region which is a little bit further down the line than we are, and to see what your experience has been. So we do appreciate you taking part, and we hope you can stay on for the next presentation as well. Thank you very much. Okay, so our next presentation, which we will start shortly, comes from Caroline Moose. Caroline is a consultant for the World Health Organization in the Schools for Health Network, and her presentation will address meeting the emotional needs of children in times of a pandemic, and that will go to some of the issues which have already been raised around mental health and mental well-being. Caroline is a teacher working in Denmark, educating young people, and she is herself especially interested in children, health, childcare, aged care. She has also taught older students with a specific interest in health promotion, and has participated in a program in rural Panama, where she had the opportunity to teach specific health subjects such as oral hygiene and nutrition with an organisation with a fantastic title, The Floating Doctors. And I'm not sure if we'd hear anything about the floating doctors in Caroline's presentation, but of course it's something we could get to, we might get to pose a question afterwards. So Anne, can we run Caroline's presentation?
Morning, thank you for joining the seminar. I would like to introduce myself briefly. My name is Caroline Maltz. I work for SHE, which stands for the Schools for Health in Europe Network Foundation. This network consists of coordinators and researchers which work with school health promotion. I work at the Secretariat, which is based in Denmark, and we work to provide a European platform for school health promotion. Using the knowledge from this network, I'd like to talk to you today about the emotional needs of children in the times of a pandemic. The network consists of 40 national coordinators across European countries that all work with school health promotion. We also have a research group that consists of 97 researchers from 24 different countries. We have new members that join each year, and we're currently working with both England and Northern Ireland in relation to membership. If the country you represent doesn't have membership, please contact me and I'll be interested in helping you work out a way to establish that. Or if you're unsure as to who your national coordinator is, you can also contact me. I can't go past this slide without saying that our network is supported by the WHO and by the European Commission. This slide is from our website and it indicates all the countries of which we have national coordinators from health promoting schools. Before I begin, it's important that we have a common definition, a common understanding of what a health promoting school is. And she regards a health promoting school as a school that implements a structured and systematic plan for the health, well-being and development of social capital of all students and of teaching and non-teaching staff. I've tried to represent that in the picture here. The health promoting schools is not simply about individual health skills and action competencies, as you can see on the right-hand side, but it involves a whole school approach. It looks at the children and their environment. So it's really important that we have participation, for example, from the children in establishing a health promoting school. It's also important we have community links also to health services. We look at the school physical environment and social environment and the policies the school has. So when we're talking health promoting schools, we're talking a whole school approach. There's no doubt that this pandemic has affected many children. Over 1.3 billion children globally have been affected. We've yet to research particularly the long-term consequences in depth. But we know that globally, more than 400,000 people have lost their lives. So children, they've lost parents, grandparents, and relatives. But what is undeniable is that the negative effects are more probable for disadvantaged and vulnerable children. We need to keep an eye out that our support strategies particularly are aimed towards the disadvantaged. So what affects the emotional well-being of children during a pandemic? Some things are more obvious. A loss of income that results in dramatic changes in a household. Lack of intergenerational social contact, also very easy to see. There is often a lack of opportunities for socialising with peers and a lack of outdoor activities. These things affect emotional well-being of children, but there are other things that are less obvious, and they're the ones I've pointed out in this slide. Parents have been more stressed during the crisis, particularly parents that struggle with illness and addictions or other conditions which worsen under, for example, lockdown. Family dynamics may become more difficult and tense during the lockdown, and in particular, some parents may be traumatised, for example, medical staff working in hospitals or people who are grieving. If we're talking about facts, these facts are taken from a survey by Save the Children, and I've looked at the European facts. So in Finland, 70% of the children surveyed experienced anxiety and 55% fatigue. In the UK, 20% were worried about the future due to school closures, and 60% were worried that a relative might fall ill. In Germany, 33% worried they may not be able to finish the school year, and in Spain, over a quarter of parents with lower income reported higher levels of distress than normal. Many reported children were struggling with fear, anguish, and concern about their family situation. These are all emotional effects of children. So what do we need to do? We need to allow for transition time. Don't rush back into the routine as if nothing ever happened. In schools, we need to allow time for discussion about this unique thing that's happened in society. We need to focus on the whole school environment. What do I mean by this? We need to look at everything, not just, for example, whether children have enough access to physical activity, but also whether they have access to clean water, whether the optimal sanitation is provided in the school. Can we improve indoor air circulation? Do we provide them with less crowded classes? We need to pay attention to the socio-ecological aspects of health promotion. And what do I mean by this? We need to foster a sense of social connection, a sense of caring for others, and in particular, the vulnerable in our society. And lastly, we need to integrate knowledge about COVID-19 in all subjects at school. By doing this, we focus on developing critical health literacy, which is required for children, particularly in relation to social media. These pictures are taken from material that have been developed by our member countries and shared across the network. The picture on the left-hand side is from Portugal. It's from material for Education for Health. It was organised by a group of secondary teachers. It was weekly material provided to the wider school community, so not just students, to keep them connected and healthy. It was designed to create a sense of laughter, connectedness, and inspire a sense of family. The middle picture is a symbol taken from material from Slovenia. Slovenia organised and encouraged online volunteers or mentors with their students. These mentors were used both to solve practical problems like homework problems or computer problems, but also used to help in relation to mental health, where children's worries were discussed in terms of the family or financial situation. On the right-hand side of the slide is from material from Lithuania. This was for kindergarten children and promoted that parents and their children use time outside on a research project involving beetles, as you can see here. I'm well aware that not all children could go outside, but Lithuania had those opportunities. Other things we need to do to provide or meet children's emotional needs. We need to increase, refine and specify the social support within and between schools, families and the local community. For example, are teachers available if parents have questions? In Portugal, the school organised local businesses to support poorer students with a computer, for example. We need to improve collaboration between schools and local services. Do children have access to a good health nurse? Do you have a clear communication plan in relation to emergencies? In Hungary, a physiotherapist organised a broadcast on national TV in terms of activities they could do in the home. We need to have a differentiated approach to students with difficulties when needed. For example, Has the school focused on subjects which we know parents have less of a capacity to help with when homeschooling? Do we provide extra help in that subject when children come back to school? We need to provide attention to play, outdoor learning and body movement. Does the school promote walking or cycling to school? And last, but certainly not least, is we need to remember to address inequality. Who needs more support? What kind of support? How do we give this support and when? This slide represents some of the resources that you can see or access online from our network. You do not need to be a member to access these materials, they are online. In particular, I'd like to point out that we have a knowledge sharing survey on the process of reopening schools. We'd like more people to participate. There's also a second survey that's specifically for school teachers. And we also have specific COVID-19 information in relation to case stories from different countries. We also have more general material available on our website. These include specific teaching materials, a school manual on how to become a health promotion school, and the standards and indicators of being a health promotion school. What are the indicators that we've reached particular standards? We would like so many more countries and schools to benefit from this network's expertise. The easiest way to do this is to subscribe to our newsletter. You can also follow us on our numerous social media platforms, Facebook, Twitter, LinkedIn and YouTube, and tell your friends and colleagues about us. The references that I've used for this small presentation are given here. I'd like to draw your attention to the fact that on our website we have a particular page in relation to materials that teachers and children can use in relation to the pandemic. Thank you for your time today. If you have any questions, you're more than welcome to contact me, and you can see my email address in green on this slide. And right at the bottom is our web address, and that is where you can access all the materials. Thanks for your time today.
Thank you, Caroline. Just as on a practical point, certainly on my screen, some of the slides, the data on them were appearing as a bit blurred. If that was the case for everybody else, don't worry about that. Some of the very valuable information which was on the slides, they will all be uploaded to the Belfast Healthy Cities website. And I think we can email all of our participants afterwards with a link to that section on our website where Caroline's and indeed all of the presentations will be available. And Caroline, we have some questions coming in for you, if that's okay. But the very first one is at a practical level from Angela Stallard, asking, could you please tell us more about the Knowledge Survey?
The Knowledge Survey is a collaboration between us and other organisations. It's clear when you click on the link. And the link on our website will tell you more about it, but it's gathering information about schools as they reopen, and we're interested about that over a European perspective. So I don't know the details about when that survey will be closed or finished off, but I do know that we'd like more people to participate, and you can find more information about that on our website. Okay, thanks, Caroline. One of the elements you referred to as being important is the integrating COVID-19 into other elements of learning, almost that it becomes part of the routine of learning. Is there a counterbalance to that? Might that be a risk that that anxiety levels would increase because COVID is deemed to be all pervasive, or is that just a judgment call that teachers and schools should make? Yeah, I think it's very much a judgment call, and I don't think that I can answer your question specifically. I think that's fair. Yeah, I think it's very much dependent upon the school and the classroom and the teacher and the context upon which you're looking at it. But I do think it's important that, as I said in one of the slides, it's important that we don't pretend it doesn't exist or it hasn't happened. It's important to give children, depending on the age, the opportunities to talk about the effects it's had on them.
Do we know, Caroline, how does anxiety manifest itself in a primary school child? I mean, it's hard to imagine, the difficulties that would involve. Is it lack of concentration? Do they not want to go to school, or is there anything you could point out about that?
And again, you're probably best to speak to a child development officer in relation to that. But there's been interesting comments across the network in terms of children and anxiety, with some reflections about, for some children that have anxiety issues before COVID-19, actually experiencing the lockdown as a positive thing, because their learning was done from the home, which is considered a very safe environment for children that have those.
Of course. Yeah. You did point out, I think it might have been Portugal you mentioned, where there were direct links between businesses and disadvantaged pupils, so that they were providing iPad. Certainly that was happening here, perhaps in an unplanned way or unstructured way, but it did happen that businesses as well as third sector organizations would have made funds available for children who didn't have access to go on to have necessary IT access for learning, and that did help out, and probably that, I'm sure that was repeated in many other countries as well. I'm going to ask Joan to come in. Joan is the Chief Executive of Belfast Healthy Cities and has been online all morning. And Joan, if you unmute yourself there before addressing any comments to Caroline. Thank you.
Thanks very much, Caroline. I think it's really interesting to hear the lots of examples from across the other European countries. And I was particularly interested in some of the work that has, we've heard a lot about COVID having a particular impact on inequalities and on disadvantage. I'm not sure if you can say much more about that, but there was, and I was actually thinking of this when Klaus was speaking as well, there were some concerns initially here when schools closed that disadvantaged children, because of their access to Wi-Fi, were further disadvantaged. And I know here children have been provided with iPads, but I mean, has there been systematic evidence on that carried about across countries, or is do we have surveys or survey results from that?
Okay, you're asking me about some very specific things, and I cannot give you any examples of specific evidence. The two surveys that we have links to are surveys that we've done, so we can collect some of this evidence.
Okay.
Yeah. Oh, I guess I just want to say, both in terms of your question and Brendan's question, if there's any sort of message that I want to send to participants in the seminar today, it's that when we're talking about health promoting schools, it's community links are really important.
Yeah.
And so a health promoting school, it's not just about that children know about the pandemic or they know how to wash their hands. That whole school approach is really important, and building community links is part of that.
Yeah. And I totally agree. Because we are working, for example, it's called the Care Zone project, and it's in North Belfast, and the local primary school has been key there and has acted as a base and has provided space for social distancing for local community organisations, for example, to distribute well-being packs across that part of the city. So when you were speaking about schools being, the essential links between communities and schools, we have several good examples here, and we have some that probably could do a lot more, but during COVID, I think some of the primary schools played a particular role within that. So thanks very much, and hopefully we will be able to access some of the results of that survey.
Our network would be very interested in hearing or speaking to some of those people that are involved with those examples. And the network attempts to provide a platform where schools and teachers can provide, I mentioned that the case stories about what specific schools do, so good case studies where people can get inspiration from each other. So we'd be more than interested to talk and put those sorts of stories up on our website.
Right, okay, that's fair enough. So I'd maybe just hand you back to Brendan. There's a final question there on managing school refusal. Due to increased anxiety. Have you any advice or resources on managing school refusal due to increased anxiety?
No, again,
yeah.
I'm not an expert in that area at all, and I think it would be very context specific in relation to the issues the child is having and the resources the school can provide.
Yeah. Okay.
Okay, thank you, and thanks, Joan, as well. We do have another comment from Angie at the West Belfast Partnership Board, who just wants to point out, as I know, there are a network of 51 schools and more than 30 community groups in West Belfast who work together on addressing issues which arise in schools in that particular part of the city. And in Angie's view, that has been a vital part in the collective response to COVID-19. So it's flagged it up. And again, that goes to the importance of sharing resource, sharing expertise. And that's probably a micro example, Caroline, of what you've been talking about in a European-wide network. So if something good or worthwhile is happening in Portugal or Lithuania or West Belfast, it's to the benefit of everybody that we find a way to share that experience. So that's the work that you're involved in. And I would encourage Angie and all of us to get involved with Caroline, share those experiences, and where we have examples or case studies or pieces of research which other people throughout the European network might be of use. Let's share that information, folks, so that we're all up to date with how we're all getting on with all of this. But it's very useful, Caroline, and thank you very much for that. And Joan, I'm just going to. I think we're moving towards the conclusion of our event now. So I want to thank Jenny, Klaus, and Caroline for the presentations, and just to re-emphasize that all of the presentations, and in fact the recording of the whole seminar, will very shortly be available on the Belfast Healthy Cities website. I want to thank the staff at Belfast Healthy Cities, especially Anne, who has mastered the technology, and she's probably now a Zoom expert, a Zoom seminar expert, and to Caroline as well. And thank all of you who logged on to join us for our conversation this morning. There will be an evaluation form circulated in the days after the event. So look, it's really useful to us as we roll out further seminars, and of course we're all getting used to doing these events online rather than in person. So it's really useful for us if you do take a few moments to complete that and send that back into us. It's helpful to us. And thank you all for joining. We're bang on time. We started at 10. We were due to finish at 11:25. It's 11:22. So maybe virtual. Maybe when you take out the tea and coffee breaks, it's more liable to run on time. Okay, so thanks very much everyone for joining, and we'll share all of that experience. And thank you for your insights. And good luck to everyone who's involved in. Be it a school setting or any other sort of setting, helping us all move out of the pandemic situation into what we all refer to as the new normal now. So thanks very much.